Just days after Lincoln City Council ended the COVID emergency, Bryan Health has some good news.
Channel 8 reporter Philip Catafamo is live in the newsroom to tell us more about this historic report. Philip?
For the first time since 2020, nobody is hospitalized with the coronavirus as of today. Over the last 3 years, Bryan Health has cared for over 4,000 people suffering from the virus.
It's been a journey over 3 years of time. From when this first began in 2020 for us, I realized the virus was first identified in 2019, but just how rapidly we had to adapt to changing times.
Wednesday marked a historic day for Lincoln as Bryan Medical Center celebrated their first day without caring for a patient with COVID-19 since the pandemic began. The news comes a few days after the Lincoln City Council voted 7-0 to end the city's state of emergency for COVID-19 on Monday. A few days before the Biden administration allows the coronavirus public health emergency to expire, marking a new era in the fight against the virus that had a grip on the nation for 3 years. Bryan Medical Center Chief Medical Officer Dr. John-Trapp says getting to this point has been a long battle.
That was really an interesting time of learning for us and evolving as a healthcare system. From drive-thrus to screenings that we were able to do. Exciting time, but also precarious time. How do we procure safety equipment, masks, N95s, gowns, those types of things? A lot of innovation happened.
He says despite all the difficulty, seeing statewide collaboration was incredible.
How we collaborated with our rural hospitals in transferring patients when they got critically ill patients. That was a journey in how we worked together. How we worked to keep patients within their own communities and enable those hospitals to care for those patients that didn't quite require transfer to a larger hospital, even if we had the bed available.
Trapp says the pandemic highlighted the value of their workforce, community outreach, the importance of supply chain, and more.
I think we learned how to build vaccines that using technology that had been around, but we applied it in a new way, and we did it very quickly and very effectively.
So where are we today with the virus? Trapp says we could see some individuals with infections that may impact some more than others.
We're going to continue to live with this, I believe, for months, if not years, going forward. And just like other types of viral infections that we've seen from time to time, we're going to continue to see some ebbs and flows.
Now, it is important to remember that COVID will still be with us for a considerable amount of time, but things are better than they were about 3 years ago. More information on what you can do to continue staying safe from the virus is included with this story on our website, klkntv.com. Back to you two in the newsroom.
Thank you very much, Phil, for that story. Still to come on the news tonight, 13 federal